Okay, we're good.
We can go ahead and get started. Okie dokie. Well, welcome back, TriBeta members, the 4 extra members other than the, the leadership, but hey, we'll take those. And also, thank you for coming, Miss Hillary. It's a pleasure to have you. And we'll just go through a few housekeeping details, and then we will get to your presentation. Sound good? Awesome. All right. So for starters, we're just like 2 weeks ago, we're still going to require that all members achieve at least 12 hours of volunteering activity or TriBeta member or TriBeta meeting hours. So each meeting will be an hour, and then we can hash out the details about volunteering hours. And you must meet at least 6 out of the 7 meetings to be considered an active member. Obviously, this comes with caveats. So if like you can email us like, hey, I had like prior obligations to this or funerals, we're obviously understanding people. So if you just let us know, we can work around with that. Also, new officer elections and new member inductions will be held at the end of the semester. So it will be, let me check my calendar real quick. It should be at April 8th, I believe. April 8th will be our induction ceremony. Let me go back to full screen. Okay, and trivia night. Obviously, due to COVID-19, just like I said 2 weeks ago, we're not going to have it in person. We're still going to do it over Kahoot. It'll just be nice and easy, relaxing, just a fun way to de-stress before finals. Obviously, you can invite anyone you want to. We don't care if they are within the required majors for TriBeta, just as long as you bring out some people. That way we can all have some fun, just kind of a competitive, good sport, good competitive games that everyone can enjoy, because it's not all going to be about biology. Maybe a little bit, but there's going to be some more stuff in there than that. Anywho, so ideas for events. For hours, we have obviously our meetings, we have the seminars, trivia night. Dr. Harper sent me an email earlier today saying that, or directly from the person who is actually managing the Southern Central Regional Convention. So that is confirmed, and it also has a $25 fee for registering. However, if you do go there, it will probably get you all of the hours you need for TriBeta. So more than likely, well, maybe not all. 12 hours is a lot. But we also have volunteering, so we're going to have tutorings every Fridays from 2 to 3. Unless we have habitat restorations on those Fridays, then we will not have tutoring that week at all. We will also have trash pickups where you can grab like a Walmart bag, fill that full of trash, or you can take like a big trash bag and then fill that full of trash, and then we'll count 1 hour and then 3 hours respectively for those. And then for the Sam Houston Museum of Natural Science, obviously you can go there on your own time, and then as long as you log in your hours that you work there, we can count that as volunteering hours. And it's
And
a really
in order to do that, you'll need to contact either Jerry Cook or William Godwin, I think is his
yes,
last
Dr.
name.
Godwin.
Yeah.
Mm-hmm.
So contact either of those two, and then they'll be able to hook you up with like something specific that you're interested in, or set up a time or whatever you want to do.
Mm-hmm. And we'll also have habitat restorations with Dr. Hudson and Mr. Allen Byboth, and I'll typically always be there for that, so we can always make sure that those hours are logged. And we'll also be having one this Saturday again, so it'll be a good work day. It'll be cold, probably wet, so bring your rain boots, bring a good thick old jacket, and don't be afraid to get dirty. And we'll also have blood drives, so as long as you can talk with any of the leadership here, and then we can get you the links to the is it Southern Regional Blood Center? More in
Gulf Coast Regional.
Gulf Coast region. Okay, so Gulf Coast region blood drives, and so that's just an easy way to get some hours. Okay, and then our presenter for tonight is Miss Hillary Langley.
Hello. So I obviously am a psychology professor at SAM, so I don't do any sort of biological research. But I thought perhaps maybe I could answer any questions that you all have about academia, maybe demystifying what it means to get a PhD. I suspect many of you all probably want to go to medical school, but if you're interested in, pursuing like a master's in biology or a PhD, if you decide that you want to live that professor life, I'm happy to, kind of tell you my story. I don't know what would be helpful for me to talk about here.
Well, I mean, you could talk about your academia, also like your research specifically. Whenever I would like extended, membership and also presentations to like psych folks, I figured that maybe we could get like some neuroscience or some maybe possibly developmental psych with that. I don't know. I mean, it's really up to you with like what you feel like would be pertinent and what's also in your life history.
Okay. Well, I'll just tell you a little bit about myself and kind of how I got here. So I am from North Carolina. I went to University of North Carolina at Chapel Hill for my undergrad. I love science. I have always enjoyed science courses. I especially loved chemistry and biology in particular. But I knew that I didn't want to do medical school because I don't do bodily fluids. So vomit, blood, mucus, any of those was that was a no-go for me. So I thought, well, what's kind of within the sciences, but doesn't involve those things. And studying the brain is something that I think is really I've always found very interesting. And I especially loved kids. So I thought, well, maybe I'll take some courses in college where I really learn about child development. Let's think about learning more about the brain and how the brain kind of matures and develops over the course of development. And so when I was at UNC, I started getting involved in research labs. So I was really fortunate to be involved in several different research labs when I was an undergrad. And so collecting data from children and families was really cool. Some of the studies that I worked on, we would collect like vagal tone data, RSA data. So basically like inner rate, heart rate variability. And so we could kind of look at some of like the physiological indicators of like, fear or stress or things like that. So we would have like mild deception or stressful tasks for babies or young kids to go through. And so we could kind of see, number one, behaviorally how they would respond to these varying stimuli, but also we could look physiologically to see, does their physiology kind of match the behavior that we're observing on the outside. We would do like genetic samples. So we would do, cheek swabs so that we could look at some genes and look at some gene by environment interactions. So say there's particular genes that would make you kind of more at risk for being aggressive, for example, but we could look at the home context and the way in which your parents raise you and see some of those kind of interactions. So did a lot of research as an undergrad, which was really cool. I did an honors thesis as well, where I collected my own data. At that point, I was really interested in babies. So I did a lot of like infant cognition stuff, which was fun. But then I was like, by the end of it, I was kind of like, babies are really fussy and they can't talk. And so I ultimately decided to apply to PhD programs in developmental psychology. I knew that I didn't want to do clinical work, so I didn't want to be a therapist or a counselor. I wanted to be a scientist, and I consider myself a scientist, not a psychologist. It took me 6.5 years to get my PhD. It was also at UNC, so it took a long time. But when you're studying development, you're studying change over time. And so you have to do longitudinal data collection where you're observing changes in terms of children level outcomes, but also parenting factors as well. In graduate school, I was really interested in children's eyewitness testimony, particularly after allegations of sexual abuse. So doing some experimental manipulations in the lab so that we could really understand under what conditions children are capable of having accurate memories of traumatic and stressful experiences. And so through that work, we did do some actually in a medical setting. So Obviously, if you're wanting to study the impact of sexual abuse, or if you're interested in figuring out, like how the stress and trauma of that, or how, asking a child questions about what happened, if you're interested in learning more about those things, it's not ethical, certainly, for you to say, okay, you 100 kids, I'm going to abuse you, and let's see what happens, and you 100 kids, we're not going to abuse you and see what happens, right? So a lot of this research is really bound in terms of what we can do in the lab. And so we would come up with these kind of unique experimental manipulations to do in the lab, to better understand, like I said, kind of what children are capable of remembering and how suggestive are they, and things like that. So in addition to those experimental manipulations, we can also look in a medical setting to see, if children are going through difficult medical procedures, for example. Those are really stressful and traumatic experiences for some kids. And so we could use that. It's happening anyways, right? The child needs this medical procedure. And so we can then interview children, afterwards, and to see kind of what they're capable of remembering. So one of the studies, for example, was children who were getting a VCUG. It's like voiding cystiosurogram something. I don't know, but essentially these are children who are believed to have bladder issues, and so they drink a solution and they stand up on an X-ray table, and then they're directed to urinate on the X-ray table while they kind of take pictures of the bladder, eliminating the urine. And so, as you can imagine, for a young child, that's quite traumatic and embarrassing and like difficult to understand. And so we would, do memory interviews after the fact to kind of see how coping strategies they used would help them, how that was associated with their recollections of the experience and things like that. So we also would do like visits where they would be like, we have worked with pediatricians where there would be like routine like well visit checks, and then we would have the physicians do some like extra event type of things, and then interview kids afterwards and see how their kind of prior knowledge of what typically happens at a well visit exam would influence, would that impact what they come to remember or not. So anyways, lots of interesting medically, related research, but not in terms of, physical health outcomes necessarily. So that was, I spent, most of my graduate school doing that, writing papers, presenting at conferences, doing research, taking coursework. I think a PhD is quite different from a med degree. And one of the primary differences I see is that during my doctoral program, I had a lot of autonomy in terms of what I wanted to focus my time on, and what I really wanted to study. And there weren't always right answers, right? So I didn't have exams, really. We would have exams in statistics, but a lot of what we did was learning how to think and finding your voice and writing, and really kind of critically thinking, as opposed to in med school and like law school, where you just have to consume all of the information and then regurgitate it back, right? You already know the answers, and so you study it, and then you're tested on that. So a PhD is quite different than that, at least from my experience, because a lot of it was learning to think. And not that you don't learn to think in medical school, you certainly do learn to think, but it's it's a different, it was a really unique experience, because in undergrad, you just would study and you would take a test and you would regurgitate knowledge, right? Well, I got to grad school and they're like, well, tell me what you think. And I'm like, well, I don't know. You tell me what I need to know, right? Like, you're the expert, you tell me. And they're like, no. Like, we're training you to think critically. You're the expert now. And so it was a huge shift in thinking and all of that. But it was really fun. I enjoyed it. It was a really wonderful time. And then I ended up doing a postdoctoral fellowship that was funded by NIH. That was also at UNC. I was there for 14 years. And that was a really interesting experience as well. So, I primarily spent my time doing research and writing, which is fun. It's something that I really enjoy. I enjoy research. I love stats. I don't always love writing. Sometimes writing, I want to kind of push it off, and but yeah, so that was interesting. And then I was like, okay, it's time to go get a big girl job, right? I'd been in school for 14 years, past high school, and applied for faculty positions, and that was very overwhelming and intimidating, right? I think a lot of individuals that get PhDs or medical degrees, you know, you have this imposter syndrome where you're like, okay, I did this for a long time and like, I'm probably competent to do this, but I'm not really sure, you know, and you're just kind of thrown into it. But I came to SAM in 2016 and I've been here ever since. And in my research lab, I am the primary mentor to 3 doctoral students. We have a clinical psychology doctoral program. And so I'm their primary research mentor, and I also mentor master's students in their research and also undergrads as well. So I have a fairly large research lab, and we do research on a lot of different things. I am particularly interested, as my kind of career trajectory has evolved, I've become especially interested in studying early life adversity, and thinking about how child abuse, neglect, trauma, just maltreatment kind of generally conceived, how that's associated with later outcomes. So we know that, you know, experiencing trauma or abuse or neglect or anything like that is associated with kind of poorer, both mental and physical health outcomes in individuals. And so in my research lab, we spent a lot of time thinking about protective or resilience factors that we could potentially identify that would maybe mitigate some of those negative outcomes that we might expect to see. So I study a lot of like gratitude and mindfulness and other kind of positive psychology things to kind of focus on. I also study gratitude in kids. It's like totally not related to medical anything, but it's something that I myself am really interested in. So I study how gratitude develops in children and what parents do to really foster gratitude in their kids. I am interested in people's misconceptions about children as eyewitnesses in the court system, and thinking about how those misconceptions could affect like jurors in terms of if they believe children when children provide testimony of some sort of, you know, abuse situation. Yeah, so lots of, I don't know, I have like, right now I have like 7 different studies that are going on. I'm launching a study right now that we're interested in how parenting during a pandemic affects parents' stress and their perceptions of their children. We're going to do like a randomized control trial where we randomly assign our participants to different interventions. So one's a mindfulness-based intervention, one's a gratitude-based intervention, and another is just a kind of like control condition. I'm also involved in a study that's funded by the National Science Foundation looking at intimate partner violence, both within heterosexual couples, but also within the LGBTQ plus community. And in particular, looking at stigma involved in intimate partner violence within both of those communities, and campus climate. So like, is SAM a supportive, you know, campus community, things like that. So I'm kind of all over the board in terms of research. I feel like I just, you know, talked a lot. So do you guys have any questions? I mean, I don't know, is anybody considering life in academia, or are you all wanting to go to medical school?
I know at least 2 of us, which is me and Morgan, are wanting to do medical. I know Stephanie is academia. I can't, or Aaliyah is is it ophthalmology or ophthalmology?
It's optimum. Wait, no, I would say it now.
I would say they're 2 very different.
Gosh, it's been a long day.
Really?
Yeah.
But the one that you need a medical degree for, ophthalmology, I think, is the one you need a medical degree for. The other one, you can go to like the
Optometry school, yeah.
Optometry school. I was gonna say eye school, but that's clearly not right.
I was really tongue-tied for a minute there. I don't know.
That's okay. It's Thursday. Yeah, I mean, so I don't know if it's helpful just to hear a perspective of like what my life is like in academia. I don't know. You know, my life every day is different, which is something I wanted. I can't imagine working a 9 to 5 and doing the same thing every day. That sounds terrible to me. And so I always knew that, like, you know, this life has afforded me, or this career has afforded me a really, you know, variable life, which is what I need and want. And so I primarily Mondays and Wednesdays, I teach several classes. And so those are kind of my teaching days where I prep to teach, and I actually teach, and I meet with students, and I grade papers, and do kind of all those things related to teaching. And then Tuesday, Thursday, Friday are my days where I do more research. So I try to write or run statistics. I'll meet with my graduate students. I have a lot of like committee meetings and stuff like that. So I'm on Zoom. Yesterday I was on Zoom from 9 a.m. until 4:15, and it was my birthday. So I was literally like on Zoom, like sitting on my butt all day. It was not the most fun, but most days are not like that, where you work with students and you just have I have a lot of autonomy, and that's one thing that I really enjoy, is that I can kind of do what I want, and I work well at night. So sometimes I'll, work from 10 p.m. to 2 a.m. and just knock shit out and, get stuff done. And then I'll sleep in until 10 o'clock the next morning, right? Because I can, because nobody knows what I'm doing. I don't have to be in the ER at, 5 a.m. seeing patients. I can, work around my schedule. And so I think that's one thing that's really nice, is to have that autonomy to kind of make your own schedule, so to speak, and that no 2 days are the same. Which is nice. And I constantly have to think, which I think is really, I love to think and I love to be challenged intellectually. And so it's a job that, I'm constantly asked questions that I don't necessarily know the answer to, but then I'm like, okay, let's figure it out. Let's find out the answer to this. And so it's really nice to be in a really intellectually challenging and stimulating environment, which is something that I especially enjoy.
I actually had a question. So, what do you look for in like research students? Like, if you were to like pick your own research students, like what would you look for in the candidates?
Yeah, I mean, I think it depends on the research study, to be honest with you. So if I'm doing like face-to-face data collection with a young child and a parent, I want to choose somebody that I trust to be appropriate with kids and parents, right? That understands boundaries, that is going to dress appropriately, that is going to, be responsible, and all of that. So I look, for interpersonal skills. I look for responsibility. I look for, is this person going to be really awkward with a 3-year-old, or are they going to be able to like hold their own when the baby, when the kid, pulls the curtains off the wall? Like, how's it going to go? If I'm interested in someone to help me, do an online study or something like that, the interpersonal skills are less important for me. And so, I look for people that are smart, that are enthusiastic, that understand the value of research. I think for a lot of students, they're like, okay, well, I'm just going to do this because I need to put it on my vita for graduate school, but they don't really care. And I understand that maybe what I do in my lab is maybe not the most exciting thing that and maybe isn't what you want to spend your life on. But I at least want to have somebody that at least fakes being interested and understands, like I said, the value of research, because I think regardless of the career that you go into, I think it's important that you understand the research process. You learn how to be a consumer of science. I think that's really vital. And you learn that by being a part of a lab. And so I think, just valuing those things and being willing to put in the work. I mean, I'll tell you, my first semester that I got involved in research, I edited heart rate data 30 hours a week for an entire summer. So it was terrible. I was working with an Excel spreadsheet and doing like find and replace, because we would have tasks that we did in the lab and they were wearing heart rate monitors. And we wanted to see like how their heart rate like kind of was variable when we would do like different types of challenge tasks or stressful types of situations. And these were like on infants and moms. And so we would like click they had like little like boxes that went with it, and we would like click when it was the start of a task or when it was the end of the task, so we could know like, okay, this is the section of the heart rate data to really look at. And so, I mean, that sucked, right? It was not fun. It wasn't glamorous. It wasn't exciting. I wasn't excited by that. But I understood that everybody starts somewhere, and that people weren't asking me to do something that they probably hadn't done themselves, right? And that you have to start somewhere, and then you'll, gradually get more responsibility. So look for someone who's willing to be a team player and willing to do things that maybe aren't that fun, with the knowledge that it will ultimately turn into something that's, more exciting or fun or, meaningful. Because not all research is meaningful. Not all research is glamorous.
One of the things I thought of whenever you brought up the interrelationship violence and then childhood trauma is, well, for just a little background on myself is that not my dad, but my mom is involved with, or she was involved with victim services, especially for Robertson County.
Yeah.
And she's also, I think she is very involved in the Brazos Valley NAMI. If I'm sure you know what NAMI is. Also, what's the something house? Someone's house. It's some kind of
The safe house?
no, not safe house. It's a name. Anyway, it's some kind of house for young children to go to. That's essentially a safe house for them who've been like sexually abused or physically abused and like by family members or whatever. But just thinking about like the pandemic and like the lockdown, as much of a crappy situation as indeed, and I think that just because we're not getting as many reports as like of just sexual assault or physical or of abuse, that we might see more. Does that concern you? I mean, obviously as a scientist, I mean, that's more data, but like on the more humanistic side, it's very troubling. Wouldn't you agree that
Yes.
this is happening?
And I think that it is actually, abuse has increased during the pandemic because we have children who are home more and we have the stress, right? We know that parental stress is associated with abuse. It doesn't mean if you're a parent that's stressed that you will abuse your kid, but we know that it is one of the kind of biggest risk factors is living in a very stressful environment. Living in poverty is also a risk factor for abuse. And so if we've got parents, for example, who lost their job and there's some sort of financial strain, that's also a risk factor for that. And then I'll tell you what, it is hard to be a parent during a pandemic when you've got kids who are having to do virtual school. I'm just going to keep it real. It's hard. I have two, they're in first grade now, but in the pandemic, they were in kindergarten and they're twins. And so they're in different classes. And so, I would be trying to teach and do my own stuff. And they had like a combined 8 or 9 Zoom meetings a day, where I'm like stressed out, I'm like, I can't do my work and teach you and do this. And they're learning to read. And I'm like, listen, I can teach adults, not 5-year-olds. And so it was just, it's hard. And so, and I know better. And so I would, we are a no hitting home. And so this is not something, for me that would ever happen, but I can imagine for a lot of individuals being stuck at home during a pandemic is really stressful. And I think that we are concerned certainly about increases in child abuse. We also are really worried about increases in intimate partner violence because there's nowhere to go, right? You can't get out of the house, you can't leave because it's unsafe to do so. And so we have seen increases in, domestic violence and intimate partner violence as well. In fact, I was in one of the research studies that I'm doing that's looking at intimate partner violence. We had put in an IRB application for a research study looking at this really around March. So when the pandemic really hit last year, and it kept getting pushed back by the IRB because we were asking really sensitive questions about violence, with romantic partners. And they were like, listen, this is a really tough time for a lot of people right now. And people are stuck at home with partners that might not be very nice. And you're asking really sensitive information. And, you should really be thinking twice about doing this because, a lot of people feel like there's no place to go right now. Because of the pandemic. So yes, I think we're all worried about increases in violence in the home, be it with kids or with romantic partners.
How do you think like that will, how do you think just the pandemic in general will influence, I suppose like our societal outlook on like mental health, because like these risk factors of like increased stress, and you said poverty, especially with like all the people getting laid off, whether that be through just companies like doing mass layoffs or what we saw with like the Keystone pipeline where a couple of, like several thousand people got laid off in like just one instant. You know, that's got to be extremely stressful, and like stress can, you know, induce some things that, you know, our mind typically wouldn't do. So I mean, do you think like this would have like a possibly be used as like a turning point for like clinicians or psychiatrists or just people in general advocating for mental health, for like boosting its importance? Because again, it's based in like our psychology, and then like it's further boosted by like our like morphology and like the biology or the biochemical structures and functions in our brain even. So like I kind of lost where I was going with that, but how do you think this will affect general mental health? I'm sorry.
Yeah, no, that's fine. Yeah, I mean, I think initially, in particular, a lot of mental health services were kind of shut down in the pandemic because status quo before was in-person mental health care. You know, if you go to therapy or counseling, you know, 9 times out of 10 pre-pandemic, that was in person. And so when it wasn't safe to be in person, a lot of that kind of shut down. And so people weren't able to receive the mental health treatment and care that they had before. You know, and that combined with the stress of the pandemic and, you know, potentially losing a job or having to, you know, homeschool your kids when you're not, you know, prepared or trained to do so. I think that was a really big problem. You know, I will say that one good thing that has come from the pandemic, though, is that we've learned that we can, well, and I say we, I'm not a clinician, but clinicians can be very effective doing telehealth, and that Zoom and other methods of kind of virtual meeting is, you know, it works. And so, you know, I suspect that there are people that have maybe who wouldn't have gotten care before because they didn't want to go in person, or, you know, cost was prohibited or things like that, that maybe now with the increase in telehealth services that, you know, like even doctor on demand, you can get you can get counseling and psychiatric care through doctor on demand, which is free with a lot of insurances, you know. And so I think that maybe is one good thing, that it kind of pushed the mental health kind of industry into a new way of delivering treatment, and they've been able to do it with pretty good success, I think. So
That is very good to hear. One thing that rural health especially struggles with not only is just like primary care, but like just psychiatry in general, and rural health is horribly underserved. So
yeah,
that's one thing that concerns me about, like, especially like our rural communities. But like with like telehealth, as long as you have like a little bit of like a service signal, you know, I've always used Verizon, so I'm kind of biased. So like if you have Verizon, you can typically get service anywhere, almost, except my house. It's completely but
oh, it's irony.
yeah, T-Mobile works just fine. How? I don't know, but as long as you can get like cell service, you can, you know, talk with someone about, hey, I'm feeling down, specifically around like this day during the winter, and that then your psychiatrist will be like, okay, so that's this seasonal I don't want to say
Fetal
depression.
affective disorder.
Okay, there we go. I didn't want to say depression because that's not correct. It's not a correct diagnosis, but or like, hey, I've been kind of feeling like I have like no emotion, or like I can't enjoy stuff, and be like, okay, so that's anhedonia. What else are you going through? And so I think that's just a great thing, is that health or telehealth is at least expanding, but it's
Yeah.
still worrying.
Yeah, they even have like text messaging situations where you can like get a therapist or clinician that you communicate, which I think for like, you know, some of our younger folks would be a really great way, you know, to connect. Yeah, so I think we're learning to use the technology. I do hear you though, in terms of some of our kind of more rural individuals who might not have access to, you know, stable internet or you know, any of that. They certainly are, you know, this is maybe not helping them. So I hope that some of you all that are going into the medical field go and serve some of those rural communities, because I think that that is where we need people. Yeah.
I'd certainly love to, but
yeah.
Again, a whole lot before there.
Yep.
Whole lot. Mm.
Any other questions?
I have a question, and I have taken maybe one psychology class in my lifetime, so please excuse my ignorance if I'm not answering this or asking this correctly. But I wanted to maybe get your take on like nature versus nurture, like growing up, especially as a child. How much does the environment play a role in a child's upbringing, if that makes sense?
Yes. And it is tremendously important, right? So we know nature versus nurture is a huge, thing that we talk about a lot in psychology. And so I study human development, and obviously, both are important, right? Some things are more biologically implicated, like the color of my eyes. It doesn't matter what my home environment was. The color of my eyes are the color of my eyes, right? But when it comes to, lots of outcomes, we know that parents are tremendously important. And so, a lot of my research focuses on contextual factors that influence development. And what I mean by that are examining aspects of the home or the school, and thinking about how some of those types of things might impact development. And so there's lots of things that are predictive. I could spend the next 12 hours going through all of them. But I think that, we know that the way in which we're raised, so we can think about like early parent-child attachment relationships. So this like essential kind of emotional bond that an infant and a parent forms as early as like 7 or 8 months of life is like tremendously predictive of later, like everything, like social skills, ability to form romantic relationships, academic competence. It's associated with so many things. And so we know, and we also know that most of the brain develops really during the first couple of years of life. So we see a ton of synaptogenesis that's happening and myelination that's occurring in the brain. And so we see a huge kind of growth in the brain. And most of that, like I said, it happens in the first 2 years of life. And so if a child is growing up in a really impoverished environment where they're not cared for appropriately, or they are, in a kind of abusive types of situation or neglect, we know that those things affect literally the development of the brain. The architecture of the brain develops differently in those kids who have been abused or neglected compared to children who are raised in a more normal environment. And so that can have tremendous downstream effects for all sorts of outcomes, right? Your social competence, your socio-emotional kind of functioning, your emotion regulation, your cognitive development. I mean, there's just a whole host of things. So yes, environment matters. But I also think it's really important to understand that we can't study either one in isolation, right? So you can't study environment without genes, and you can't study, genes and biology without environment. And so they're so intricately connected that it's really impossible for us to really parse that apart. There's a lot of really interesting kinship studies that are done in psychology where they'll have groups of like identical twins and compare that to fraternal twins and compare that to just siblings. And like best case scenarios, you got identical twins that were raised apart. I mean, not best for the people, but best for the science, because then you can really better understand, these are two people who share essentially 100% of their DNA, but their environments were different. So things that are similar between those two folks, you can say is really a function of biology, and the things that are different are really a function of the environment. But yeah, I mean, I think the biggest predictor of stuff later on in life is having a really warm, supportive, nurturing relationship with at least one primary caregiver. And it doesn't matter if you live in poverty. It doesn't matter if you're, a lot of that stuff doesn't matter as long as you're warm and responsive and loving and kind, and you don't hate your kids. Those are the two things that you should be really warm and loving and kind, and you shouldn't hate your kids. And that's most predictive of positive stuff. So I tell my students, I want you to learn two things in my class. One is if you're having unprotected sex, I want you to make sure, and you're a female, I want you to make sure you're taking folic acid. That's really vital for neural tube development. So remember that. And number two, don't spank your kids because it's associated with a whole lot of really bad stuff. And I can give you all the science if you're interested. But those are my two soapboxes that I'm like, I don't care if you remember anything else from my class, remember those two things.
Could you give us a very abridged soapbox speech about corporal punishment?
I was
'Cause
spanked as
we've
a
only got
child.
we've only got like maybe 10 or so minutes left, but like I'd be really interested to hear this, because like I grew up like with spankings.
Yeah.
And everyone in my small town of like 2,000.
Everyone in Texas grew up being spanked.
Oh yeah, I'm sure.
I was spanked. And you know what? I called my mom after I learned about all of this stuff, because I used to think it was a crock of shit. I'm going to be honest, excuse my language. But I used to think like kids are brats because parents don't spank their kids any longer. You know, and I was like, I was spanked and I was great. And I'm sure that's why I'm great. But I have you know, I saw Jesus, and I have changed my tune, because the science is unequivocal. It is hard to dispute the science. And what the science says is we have 50 years worth of data from like 50 countries, from like 50,000 people, that across the board says that spanking and hitting your children is associated with negative outcomes, particularly psychopathology. So thinking about increases in internalizing disorders like anxiety and depression. We see it's associated with aggression. So externalizing disorders or aggression in our children, and just poor outcomes altogether. And you know, the worst style of parenting is being a really warm, loving, nurturing parent that hits your kids. That's actually associated with the highest level of psychopathology and anxiety and depression and just bad stuff in kids. So I know, same here, right? Mama loved me, but and so it just is, it's tough. And I know culturally, like I'm from North Carolina, where spanking has really become more of like viewed as like an abuse thing. And I came to Texas, I vividly remember my first semester having this conversation. You know, I got a room full of 200 students who grew up in Texas, and they're like, Dr. Langley, you do realize we were all spanked, right? And I do, but you know what? I think we didn't know at the time that it was associated with negative outcomes. I think that it has just, this is a thing that's been passed down from, one generation to the next. But again and again and again, we have shown, number one, that spanking is associated with bad outcomes, and number two, that it doesn't work. It doesn't correct children's behavior. And so if you're hitting your child to get your child to behave differently, you need to engage in a different style of punishment. And so I'm not saying that you shouldn't have consequences and that children, don't need to understand right from wrong, because that is a vital part of parenting. But we know that there are lots of other methods of punishment and methods of parenting that don't involve physical punishment that are actually associated with changes in children's behavior. And I just think, now we know. And it used to also be the case that people believed that there were kind of cultural differences. So like maybe like initial evidence from this research really showed that like white kids in particular that were spanked, that was associated with the most negative outcomes, and that we didn't necessarily see as many of those negative outcomes within the African American community. And part of that was, I think, because it's kind of more culturally normative. But as the data has continued to be collected, over the past couple of decades, it's really begun to emerge that regardless of your ethnic background, it is just, across the board, just not great, And so anyways, I, like I said, I saw Jesus, and I changed my tune, and I joined a new religion, and I called my mom, and I was like, Mom, I got a little bit of anxiety. And I'm like, I think it's because you spanked me. She didn't really like that, but anyways, I'm happy to send out articles to you guys if you're interested. I know it's a really touchy subject, and this is something that, most of mine and your generation probably lived through, and you're okay. But I do think that this is something that we now know better. And it doesn't work. So that's another big thing.
Well, I like the pun that you didn't mean to put in there, but touchy subject. Very.
Yeah, it's tough. I know, but
yeah, it's kind of a bad way to reference it. But thank you. Or if does anyone else have any questions? We're almost out of time here. No, I suppose not then. Well, again, thank you so much, Dr. Hillary.
You're welcome.
Along and speaking to us about like just your research in general and your thoughts. I honestly really enjoyed it. I like psych, and I think it's honestly an important thing that a lot of biologists overlook. But
yeah, the brain's important, right? And behavior is important too. If you're going to be working with people, you know, learning how people think and what affects behavior and stuff like that, I think is important. So I'm sure in med school for you guys, you'll take some, you know, some psych courses and, you know, hopefully you'll enjoy it. So it was great to talk to you guys. Yeah, reach out if you have any other questions or anything. And good luck to you all in your endeavors in biology, and yeah, have fun.
Thank
all right.
you.
Yeah, thank you so much.
Thank you.
You're welcome. All right, bye guys.
All right. See ya.